Hello and welcome back to another video of the Brainy Heart. This video is part 2 of a 2-part video series. In part 1 of this video, I talked about type 1 myocardial infarctions. If you want to check out that video, click here and I'll also link it below in the description. In this video, we will be taking a look at type 2, type 3, type 4A, 4B, 4C, and type 5 myocardial infarction. So let's get right into it. Before I talk about the remaining types of myocardial infarctions, let me give you a brief overview of the type 1 myocardial infarction. Now obviously, if you want to learn more about the type 1 myocardial infarction, you should check out my previous video, like I said before. But this is just an overview so that you can understand and compare the remaining types of myocardial infarctions. So type 1 myocardial infarction is when you have coronary artery disease with plaque rupture and coronary thrombosis. So let's say this is the coronary arteries. The coronary arteries actually wrap around the heart, supplying the heart muscle with blood. But just for the sake of simplicity, I'm gonna draw it like I have. So your heart muscle has its own set of arteries. So when the blood leaves the aorta, after it has gone through the heart, some of the blood goes to the coronary arteries. So a heart attack is when your heart is deprived of oxygen and the cells in the heart muscle, which are called cardiomyocytes, start dying. And this can cause the heart to be less effective in pumping out blood and oxygen to other parts of the body, which can cause other organ failures. The type 1 myocardial infarction is when you have coronary artery disease with a plaque rupture or coronary thrombosis. So, plaque can be formed in any artery in the body, and this is actually called atherosclerosis. It is when a fatty substance like plaque or cholesterol builds up on the arterial walls. And when this plaque ruptures, it can form a blood clot. A blood clot is formed when platelets are accidentally triggered and they clump up to make a platelet ball. A blood clot is also called a thrombin. So this blood clot is called a thrombus, and the condition of having a blood clot in an artery or vein is called thrombosis. And when you have it in your coronary artery, it's called coronary thrombosis. Pretty simple. The problem with this is that the blood from the aorta, which is oxygenated, is coming in with a lot of oxygen supply for the heart muscle. Normally, it would just pass through and with no problem, it would be supplying the heart muscle with blood. But that will not be possible because there is a block, so no blood can get past this block. Now, if the block is small, maybe it can leave some blood to pass, but that will still be a problem because there's very minimal blood flow and there is not enough oxygen for the heart. There's more demand and less supply. And when the block blocks the whole artery, then no blood is passing through, meaning the heart muscle is going to die faster. And on the right here, I have EKGs. So you can either be diagnosed with a STEMI, which is a ST segment elevation myocardial infarction, or a non-STEMI, which is a non-ST elevation MI. ST elevation MI is when your whole artery is blocked because of the thrombus, and no blood is passing through. A non-STEMI is when the thrombus blocks most of the artery, but there's still minimal blood flow. If you want to learn more about the EKG, you should check out my video on the electrical conduction system of the heart, which I'll link up here and below in the description. The main purpose of this overview was to help you compare other types of myocardial infarctions with the type 1, which is the most common one. Now let's talk about the other types of myocardial infarction. There are 6 more types of myocardial infarctions. So let's get right into it. Let me start off by talking about the type 2 myocardial infarction, which is somewhat common but less common than type 1. So a type 2 myocardial infarction is basically the same thing as a type 1 myocardial infarction, but in a type 2 myocardial infarction, there is no coronary thrombosis or a plaque rupture. But it's the same logic. Your heart is getting deprived of oxygen and there's going to be more demand and less supply. And this can cause other parts of the body to receive less oxygen because your heart is not going to be pumping effectively, and this can cause organ failures and end up resulting in death. If a thrombus is not the problem, how else can there be a supply-demand imbalance? Well, just atherosclerosis alone can cause this. This plaque can form so severely that it can form on both sides of the arterial walls, and it can basically block the whole artery or narrow the blood flow. So your blood will have to flow through this small gap in your artery. So your heart muscles obviously gonna have very less blood flow, and there's gonna be demand and very little supply. So your heart muscle and the cells in the heart muscle start dying. And when this happens, your cardiomyocytes, which are the heart muscle cells, start releasing troponin, which is a protein that is released when the cells die. And this troponin is mixed with the blood, and one of the tests that doctors do if you go in with a chief complaint of any symptoms of a heart attack, then they'll immediately take a troponin level check to see if the troponin levels are normal. If the troponin level is high, that means you might be having a myocardial infarction. Now, coming back to a type 2 myocardial infarction,
The problem
it doesn't have to be atherosclerosis. It can be some other condition. Maybe your artery gets constricted, and that is called a spasm. So when your artery basically gets narrowed down in one area, and if this is the actual size of the artery, this area is obviously narrowed down. So less blood will be able to pass through. And in more severe cases, the spasm might be bigger, making the artery even more narrower in that area. So again, the heart muscle is going to be demanding for the blood, but there's less supply because of either the atherosclerosis or the vasospasm. And a type 2 myocardial infarction can also happen when your heart is pumping ineffectively. It's not being smart. So this can happen when you have tachycardia, which is high heart rate, or it can happen when you have high blood pressure, or it can happen when you have atrial fibrillation, or it can happen when you have heart murmur, or things like that. It's basically when your heart is pumping blood inefficiently. So it might be pumping really fast, and because of this, it's not pumping enough blood because it's pumping, pumping, pumping. And when the heart is beating fast, the valves will be opening and closing really quickly, meaning that they can't get all the blood to the specific area. This causes blood to stay back in the heart, and this can have a effect on the heart itself. If the blood is not coming out of the aorta, the heart muscle cannot be supplied. This normally causes sudden cardiac arrest, which will lead to death within 5 to 10 minutes if CPR is not conducted, or you can use a defibrillator. So just to review, a type 2 myocardial infarction is when there is a supply-demand imbalance which is not caused by a thrombus. If it's caused by a thrombus, that means it's a type 1 myocardial infarction. If it's not caused by a thrombus but it's still there, it's most likely a type 2 myocardial infarction. And a type 2 myocardial infarction can be caused by a spasm, and that's when the artery gets narrower, or it can be caused by atherosclerosis, or it can be caused by severe atherosclerosis, meaning that the plaque or cholesterol builds up on both sides of the artery, and there's a lot of buildup, so the artery can be narrowed and causing less blood to pass through. A type 2 myocardial infarction can also be caused when your heart is beating insufficiently. Maybe this can be caused by tachycardia or atrial fibrillation, or it can be caused by hypertension, which is high blood pressure, and things like that. Type 1 and type 2 are commonly confused, but these are some of the ways that you can check. A EKG is also taken for a type 2 myocardial infarction to check if the heart is doing properly or if it's beating insufficiently. Some of the things that a doctor might do when you have a type 2 myocardial infarction is that they will give you blood thinners. These blood thinners breaks down the plaque, and it basically removes the plaque, and there's more area for blood flow. For more severe cases, a angioplasty can also be performed, and that is when a balloon is sent into your artery, and when it inflates, it pushes the plaque and cholesterol into your arterial walls, and then a stent is placed to make sure a plaque cannot form in the same exact area. Here's a quick animation of a angioplasty because it's kind of hard to draw it out. As you can see, a catheter is sent into the coronary artery, and then the balloon inflates, pushing the plaque into the arterial walls, and then the stent is left behind in order to avoid narrowing of the artery and rebuild-up of the plaque. And in more severe cases where angioplasty will not work, a bypass surgery can be performed. So a bypass surgery is when normally the saphenous vein is taken from your legs, and it basically acts as a extra artery that basically goes around the block to supply the heart muscle. When the saphenous artery or the saphenous vein is taken from your leg, it's stitched into one of the arteries coming off the aorta, or it can be also stitched directly into the aorta, and some of the blood will travel down this vein, or now a artery, and it will go into your heart muscle, and it's basically gotten past your block. So this is a surgery, and this can have some side effects. You'll be given anesthesia, and it will obviously have side effects on the patient. But this is done for very serious cases. So that was the type 2 myocardial infarctions. Now that we've talked about the type 2 myocardial infarction, let me briefly talk about the remaining types of myocardial infarction. The ones that remain are the type 3, type 4, and type 5 myocardial infarctions. Let's start off by talking about the type 3 myocardial infarction. A type 3 myocardial infarction is when the myocardial infarction results in death when no biomarker values are available. So what is a biomarker? A biomarker is a measurable substance, and the presence of a biomarker might indicate a disease, problem, infection within your body. For example, troponin is a biomarker. When troponin levels are high, it most likely means you're having a heart attack or a myocardial infarction. So that was the type 3 myocardial infarction. Next, we have the type 4 myocardial infarctions. The type 4 myocardial infarctions are split into three different subcategories: type 4A, type 4B, and type 4C. All you have to know about all three of them are that they are caused by some sort of problem. All you have to know about all three of them is that it is a heart attack caused by problems associated with angioplasty. Now, let's talk about the type 5 myocardial infarction. A type 5 myocardial infarction is caused by problems associated with the coronary artery bypass grafting. The coronary artery bypass grafting and the coronary artery bypass surgery are pretty much the same thing. When the word graft comes up, just know they're talking about the artery serving as the detour. Previously in this video, when I was talking about the coronary artery bypass surgery, I said that the saphenous vein is usually used as the detour. The saphenous vein would be the graft. And just know that the saphenous vein is the most commonly used one, but it's not always the saphenous vein. It could be some other vein or artery. But that artery or vein that serves as the detour is known as the graft. So type 5 myocardial infarction is caused by problems associated with the coronary artery bypass surgery or grafting. So just to review, the type 1 myocardial infarction is when you have coronary artery disease with plaque rupture and coronary thrombosis, and this can either be a STEMI or a non-STEMI. The type 2 myocardial infarction is when there is a supply-demand issue, just like type 1, except now, in type 2, there is a supply-demand issue without thrombosis, so it's caused by something other than a thrombosis. In type 3, the myocardial infarction results in death when biomarker values are not available. Type 4 myocardial infarctions. The myocardial infarction is caused by problems associated with a previously done angioplasty. And finally, the type 5 myocardial infarction is caused by problems associated with a previously done coronary artery bypass grafting or surgery. Now, one thing that's common among all the myocardial infarctions is that they all cause a supply-demand issue. The heart muscle is going to be demanding blood always, and if the supply drops because of a myocardial infarction, the heart will start beating inefficiently, and this causes the rest of the body to not receive enough blood. And this can cause organ failures and eventually death. But that was it for today's video. I hope you enjoyed it and learned from it. I'm always open to comments, questions, and or suggestions. This is the Brainy Heart signing off. I'll catch you later in the next one.